Okay, good evening, students. So today, now we are going to start and complete the part second remaining portion, that is your allergy and that remaining disease part. Okay, and start infectious and non-infectious diseases. Okay, so let's get started. First, we are going to discuss about allergy. Okay, so allergy, what is this allergy? Okay, so allergy is nothing, it is an exaggerated or excessive immune response of your body against the immunological disorders. Okay, means extra response, extra power of your immunity when come out from your body, it is called allergy. Okay, so the reaction of immune system to some antigen in surrounding is known as allergy. Okay, it is an allergic reaction in which your immune system work against that thing and give it aggregated form. Okay, means if there is antigen or some allergen inside the atmosphere, if you inhale that allergen inside your body get a overacting reaction to that allergen, that thing is called allergy. Okay, so the reaction of immune system to some antigen in the surrounding is known as allergy. Allergens, the agents that cause the exaggerated reaction of immune system, example dust mite, pollen grain, animal dander, wolf and nail polish, these all are allergens that you inhale, and due to the inhalation of these allergens, it will exaggerated your reactions of immune system, due to which your body doing some excessive work. Okay, so antibodies are produced in response to allergen is IgE. Okay, IgE type of antibodies is produced in the allergic reactions. Okay, in allergic reaction these IgE come and fight against these allergen. Okay, so common symptoms of allergy are sneezing, watering eyes, rashes, running nose and asthma. Okay, it is common, you know, when that allergy take place. Okay, you are some people are allergic to something, just like me, I am allergic to banana. Okay, if someone eat banana in front of me, or I get the smell of banana, then I get allergy of this. Okay, in this I get sneezing, watering eyes, rashes, running nose. Okay, but I do not get asthma. Okay, asthma get in severe cases. Okay, this asthma, okay, the symptom of allergy is come out in very severe cases of allergy. Okay, so release of histamine and serotonin are the causes of allergy. Okay, in allergy what happens inside your body, that histamine and serotonin release out. Okay, in allergy what happens inside your body, that histamine and serotonin releases from mast cells. Okay, from the mast cell produces symptoms of allergy. Drugs, steroid, antihistamine and adrenaline swiftly reduce the symptoms. Okay, the drugs which can you use as a anti-allergic drugs, these are some steroids, antihistamine drugs, like usually you use that thing. Okay, cetirizine and levocetirizine, that is antihistaminic drugs. Okay, and adrenaline swiftly reduce the symptoms of allergy. See, allergy, what these two do: histamine, this is your vasodilator. Okay, serotonin, it is a vasoconstrictor. Okay, so these things increase or decreases the blood pressure during that allergic reaction. So these drugs control that thing inside your body. Okay, so this is a summary of allergy, that is caused by mites in dust, pollen and animal dander. Symptoms: sneezing, watering eye, running nose, difficulty in breathing. Okay, releases histamine and serotonin. Okay, now body form, that antibody which fight against that thing is your IgE antibody, and cured by antihistamine, adrenaline and steroid drug. This is the summary of your allergy. Okay, next is your autoimmunity or autoimmune disorder, in which your own body immune system start to attack on your own body. Okay, when the immune system does not discriminate between self and non-self antigen, antibodies are formed against the self antigen. Okay, when your body antibodies, your body immune system start to killing your own cells, then it is autoimmune disorder. Okay, memory-based acquired immunity evolved in higher vertebrates based on the ability to differentiate from organisms, pathogen from cell. While we still do not understand the basis of this two, coordination of this ability have to be understood. Okay, still we are not that much sure understand about this ability of our immune system. Okay, that's why I said in the starting of chapter, your immune system is the most complex system of your body. Okay, we do not know full of our immune system. We till now we only knew about half percentage of our immune system, how our immune system work. Okay, so when your immune system is acting on your body, killing your own body cell, then that condition is called autoimmunity or autoimmune disorders. Okay, so one higher vertebrate can distinguish foreign molecule as well as foreign organism. Most of the experimental immunological deals with this aspect. Okay, two, sometimes due to genetic and other unknown reasons the body attacks cells. This result in damage to the body and it is called autoimmune diseases. Okay, so some of the autoimmune diseases, first we have myasthenia gravis. In this, what happen, your antibodies forms against acetylcholine receptors. Okay, in which acetylcholine does not release. Okay, and the muscle will get stitches. Okay, then pernicious anemia against Cashel intrinsic factor, that is CIF. So the vitamin B12 is not absorbed. Okay, in this condition, pernicious anemia, what happen, deficiency of vitamin B12 take place, and the reason is autoimmune disorder. Okay, in which that cells which absorb vitamin B12, they are killed by your own antibodies, and now you cannot absorb vitamin B12. Okay, third disease is Hashimoto disease. Okay, in which what happen, the thyroid gland is attacked by your own immune system. Okay, in this Hashimoto disease, what happened, BMR decreases. The person who having Hashimoto disease, they are having that BMR, that your dietary related conditions or symptoms. Okay, next we have rheumatoid arthritis, which we are going to study in detail. Okay, then insulin dependent diabetes mellitus type 1 diabetes, in which beta cells of pancreas get attacked by your immunity or your antibodies. Okay, as you know, beta cells in pancreas is responsible for the production of insulin. So what happened in this insulin dependent diabetes mellitus, what happened, these cells are killed by your own antibodies and causes diabetes mellitus type 1. Okay, next is multiple sclerosis. Okay, in this what happened, the myelin sheath of nerve cells get attacked by your own immunity, and due to which multiple sclerosis take place. Okay, so now we are going to study in detail about rheumatoid arthritis. Okay, so it is due to the presence of rheumatoid factor, a type of immunoglobulin IgM. Okay, in this condition what happened, your IgM antibody attacks the synovial membrane. Okay, so in this primary symptom is inflammation of synovial membrane. If it is left untreated, then the membrane thickness and synovial fluid increase, exerting pressure that causes pain. Okay, just like you know, all the movable joints which is present in your body are type of synovial joint. Okay, so when this disease occur, what happen, that joints, okay, at that area, this IgM will produce, and due to this IgM, it start to killing, it start to degrading your synovial fluid, due to which it exert more pressure, and when you move your joints, it will make pain inside your body. Okay, the membrane then starts secreting abnormal granules called pannus, which after accumulating on the surface of cartilage causes its erosion. Okay, just like for example, this is a joint. Okay, now what happened, after some time when this thing will happen, the synovial membrane, the synovial fluid start to solidify and converting into pannus like materials. Okay, now when your joint moves, these pannus to each other, and due to that eruption, erosion take place inside the cartilage and bones, due to which pain occur. Okay, as a result, the fibrous tissue are attached with the bones and become ossified, making the joints immovable. Okay, after some time what happen, these bones, okay, as you know, when fracture take place, the bone get fractured. Okay, after some time when you put the plaster, you do immobilization. Okay, your bone get stripped, your bone become rearranged. Okay, same thing happen in this. The fibrous tissue that is attached to each other, they ossified and now they become immovable. Your synovial joint convert into a non-movable joint or fibrous joint due to this disease. Okay, treatment: pain and inflammation by heat treatment and physiotherapy, joint replacement surgery in done in extreme case, severe case in which you have excessive pain and your joint are having zero mobility. Okay, so this is your rheumatoid arthritis. In this condition, this the thickened synovial membrane will occur, due to which synovial fluid is filled in this. Okay, and this synovial fluid start to degenerate your cartilage. It is means that thing, when this cartilage degenerates, it will do not allow your cartilage to move and it will become ossified. Okay, and the person who having this, its hands look like this. Okay, they are does not move. Okay, गांठ पड़ जाती, they cannot move this thing. Okay, next is your immunodeficiency disorder. Now in this condition, what happening? You are getting deficient. Okay, your immune system getting deficient. The number of antibodies which is present inside your body, the immune system of your body is going down. Okay, so we have two diseases related to this immunodeficient disorder. First one is your SCIDS and second one is your AIDS. Okay, SCIDS is severe combined immunodeficiency. Okay, in this disorder, due to a gene mutation involving deficiency of enzyme adenosine deaminase, this enzyme involved in maturation of T and B lymphocyte, and affected individual also dies at the early age. Okay, see in SCIDS what happened? It will done by a deficiency of enzyme which is known as your enzyme adenosine deaminase. Okay, adenosine deaminase, this enzyme is reduced inside your body or not produced inside your body. Due to the not production of this enzyme adenosine deaminase, your B lymphocytes and T lymphocyte does not get mature, and due to that not getting mature, that immune system of your body automatically fall down. Okay, so treatment is gene therapy. You have to put the gene is producing this enzyme inside the body. Okay, second one is AIDS. This is world famous. Okay, acquired immunodeficiency syndrome caused by HIV virus. Okay, HIV attacks on T helper cell. This causes the decrease of count of T helper cell from normal 900 mm per cube to less than 200 per mm cube. Okay, is this HIV AIDS, we are going to study it in detail in the further part of the chapter. Okay, now it's time for infectious and non-infectious diseases, different types of diseases. Okay, first of all, see this is a patient who having SCIDS and this is the patient who having AIDS. Okay, this how AIDS affects a function of people. Okay, a person. So now we are going to start with diseases. Okay, types of diseases, different types of diseases. So there is 4 types of disease basically. Okay, bacterial, viral, fungal, helminthes. Okay, all these are different diseases on the basis of type of pathogen. Okay, so first we are going to start with bacterial disease caused by bacteria. Okay, so first disease we have typhoid caused by your Salmonella typhi. Okay, this is a life-threatening bacterial infection that affects the small intestine and can spread throughout the body. Okay, typhoid fever is very dangerous to the body. Okay, symptom: typhoid fever symptom include high fever, fatigue, headache, nausea, abdominal pain, constipation and diarrhea, racy bloody stool, still, agitation, confusion, delirium, hallucination. These all are the symptoms of your typhoid. Okay, now we are going to discuss what are the symptoms. High fever, you know high fever what is. Okay, the temperature of body more than 37 degrees Celsius. Then fatigue means your body get easily fatigued, your body become restlessness. Okay, headache, that माथे का दर्द. Okay, जो तुमको होता है हर टाइम. Nausea. Okay, nausea means you are not feeling well. Okay, then you have abdominal pain. Okay, as this affects your small intestine, so automatically abdominal pain is there. Okay, constipation and diarrhea both happens in this disease. Okay, constipation means you are not having a proper excretal time. Okay, means your excreta not coming properly, and diarrhea means there is excessive excreta coming out with more water. Okay, rash blood stools. Okay, your stools, the blood is there. Okay, chills, agitations means your body become chills means kapi nikalti hai. Okay, then confusion. Okay, when you see, when you want to that focus on something by your eyes, you will confused by seeing that. Okay, delirium, that means you getting means a condition, a term in which you feel very bad. Okay, then hallucinations. Okay, means दिन में तारा दिखना. Okay, next cause, typhoid fever is caused by bacterium Salmonella typhi, which is related to the bacteria that cause Salmonella food poisoning. It is usually spread through contaminated food and water. Okay, treatment, typhoid fever can be treated with antibiotics. However, antimicrobial resistance is common, making treatment more complicated. The bacterium Salmonella typhi, it is very dangerous. Okay, and even some antibiotic does not have the power to kill that thing. That's why it is written here, antimicrobial resistance is common in this, so treatment is more complicated. Your typhoids, that Salmonella typhi, having antimicrobial resistance power. Okay, then complication, without proper treatment, typhoid fever can cause serious complication and even causes death of the organism. Okay, the test which is used to confirm that the person having typhoid or not is Vidal test. Okay, so this is the condition of patient who having typhoid. Okay, and this is how your typhoid bacteria look like. Okay, next is pneumonia. Second bacterial disease, pneumonia caused by Streptococcus pneumoniae, okay, or Haemophilus influenza. Okay, Streptococcus pneumoniae or Haemophilus influenza, these are the causative organism of your pneumonia. Okay, it is a droplet aerosol infection which spread from droplet. Okay, means I have, if pneumonia and I sneezed. Okay, now if in some people are in this room, if they inhale that droplets which is present inside the air which is sneezed by me, if intake that, then they also get that pathogen inside their body. Okay, just like your corona. Okay, of use of Haemophilus influenza, glass or utensil of infected person infect alveoli of the lungs. Okay, it infects your alveoli. Okay, it got act on your alveoli of lungs. Okay, alveoli get filled with fluid leading to severe problem of respiration, fever with chills, cough and headache. In severe cases, lips and nails turn grey to bluish in color. Okay, in severe cases of pneumonia, the leaves and nail color, okay, become bluish to black. Okay, इसमें जो सबसे मेन जो डैमेज पहुंचता है वो एल्वोलाई को पहुंचता है, लंग्स के अंदर पानी भर जाता है. Okay, that's why you cannot respire properly. Okay, that's the normal alveoli. Okay, and this is the pneumonic alveoli in which you will see that filled with water. Okay, this is water, yellow color water. Okay, you can see here, see this water, all where water. Okay, and this is the x-ray of a person who having pneumonia. Okay, and this is also an image. It is a healthy alveoli and this is the alveoli which having that pneumonia. Okay, see that whole alveoli is filled with water. Okay, that air sac filled with fluid, inflammation in alveoli. Okay, swollen bronchial, whole respiratory system get collapse in this disease. Okay, next is dysentery. Okay, third bacterial disease is dysentery. Okay, it is a GIT infection that causes severe diarrhea with blood or mucus. Other symptoms include fever, abdominal pain and feeling of incomplete defecation. Means you go for fresh, you go for potty, but you do not think, you feel that I do not go for potty. ओके, मतलब तुम पॉटी के लिए जाते हो, तुम पॉटी करके भी आते हो, पर तुमको फील नहीं होता कि मैं पॉटी करके आया हूं. ओके, दैट टाइप ऑफ सिम्टम्स अकर इन डाइसेंट्री. ओके, बार बार बाथरूम जाने की जरूरत पड़ती है. So dysentery is very contagious and can caused by bacteria and parasite. Okay, dysentery can be caused by bacteria and can be caused by your protozoans. Okay, so the dysentery which is caused by bacteria, it is called bacillary dysentery, caused by bacterium like Shigella, Salmonella, Campylobacter. okay, and E. coli. Okay, these are the bacteria who causes bacillary dysentery. Okay, so it is the most common type of dysentery. Dysentery is most common in countries with poor sanitation, just like African countries. Okay, moist climate, it can be transmitted through contaminated food and water. Okay, mode of transmission is contaminated food and contaminated water. Okay, or physical contact with infected person's stool. Okay, to treat dysentery, you can drink plenty of water or rehydration. In this disease, dehydration is common because you are regularly going to washroom for that stool removal from your body for defecation. Okay, so that's why dehydration is common. Okay, next, to prevent dysentery, you can practice good hygiene. Okay, ensure food is cooked thoroughly, avoid consuming raw and uncooked food, and drink safe and clean water. These all are the preventions of dysentery. Okay, so see this what thing happened. This is that amoeboid. Okay, this is sorry, that one is that parasitic dysentery, in which the parasite occupied all small intestine. Okay, so these are the symptoms of amoebic dysentery. Okay, that is diarrhea, high fever, nausea, vomiting, weight loss, and upset. This is your amoeboid caused by protozoan, and this one is your bacillary dysentery caused by bacterium like Salmonella, Shigella, E. coli, Campylobacter. Okay, diarrhea containing blood and mucus, high fever, nausea and vomiting, painful abdominal cramps. Okay, these all are the symptoms of bacillary dysentery, while these all are the symptoms of amoebic dysentery. Okay, the difference between, okay, in this you have diarrhea, high fever, nausea and vomiting, weight loss and upset stomach, but in bacillary dysentery you will find diarrhea with blood and mucus. Okay, high fever, here you have only normal diarrhea in amoebic dysentery, but in your bacillary dysentery the diarrhea is bloody or mucus. Okay, it contains blood or mucus. Okay, high fever, same, in this you have high fever. Okay, nausea and vomiting, same is there. Okay, then painful abdominal cramp. Okay, same thing is here also, but the basic difference, you have here common diarrhea. Okay, but in bacillary dysentery caused by Shigella, okay, Salmonella, Campylobacter or E. coli, having blood or mucus inside your potty or fecal material. Okay, next is your plague. Okay, next bacterial disease is your plague. Okay, plague is a serious illness caused by germ called Yersinia pestis. Okay, the germ mostly live in the small rodents and their fleas. The most common way of human to get plague is flea bite. Plague is a rare disease. Okay, now it is a rare disease, but during the time of World War I, okay, this is a havoc, just like your corona. Okay, it is an endemic. Okay, pandemic, endemic, it is really that is spread throughout the Europe that time. Okay, symptoms: sudden high fever and chills, headache, tiredness, not feeling well in general, weakness, muscle ache, rarely skin scores, enlargement of axillary lymph nodes. Okay, the axillary lymph node, this thing will happen. This is bubonic plague, history, symptom, cause and more. Okay, this is your bubonic plague. Okay, plague के बहुत सारे टाइप होते हैं, तुम्हारे कोर्स में नहीं है. Okay, you have only a simple plague definition, that is caused by, plague is caused by bacteria called Yersinia pestis. The bacterium circulate in population of small animals and their fleas. Okay, इसमें देखो तीन वो होते हैं. पहला होता है रेट के ऊपर होती है एक पैरासाइट जिसका नाम होता है फ्ली, और उस फ्ली की बॉडी के अंदर होता है ये माइक्रोब Yersinia pestis. Okay, so when that infected rat by a flea bites you, this disease or pathogen automatically go inside your body and it causes this like conditions. Okay, lymph node swelling, pus, exudate, bleeding, gastric, nausea, vomiting, joint pain and acne, fever, headache, malaise. These all are the symptoms of bubonic plague. Okay, see, this what the condition in this disease happen. All the areas is been blackened down. These like this, in this your lymph nodes getting swelled up and the pussy thing is coming out from that area. Okay, next disease, bacterial disease, is diphtheria. Okay, it is a contagious bacterial disease that can be life threatening. It is caused by Corynebacterium diphtheriae. Okay, bacterium which produce a toxin that can damage healthy tissue and cause serious health problems. In this disease, a toxin called diphtherin toxin secreted out by your bacteria Corynebacterium diphtheriae, which affects your body. Okay, symptoms: fever, sore throat, swelling, neck glands, and pseudomembrane that cover the mucus lining of throat, tonsil, larynx, and nose. Okay, इस disease में क्या होती है, एक pseudomembranous lining बनती है inside your mouth. Okay, that pseudomembranous lining which inhibits the gaseous exchange. Okay, that gas does not get purely enter inside your respiratory tract due to that pseudomembranous formation. Okay, type: respiratory which affect the upper respiratory tract, and cutaneous which affect the skin. इसके दो type होते हैं. First type which affects your respiratory system, second type which affects your skin, which causes dermatitis like conditions. Okay, transmission spread by direct projection, droplet spread when an infected person cough or sneeze in public. Then prevention: diphtheria का एक वैक्सीन है जिसको बोलते हैं अपन DTaP, in which you have three other disease vaccines are also there. When you inject that vaccine DTaP contain diphtheria, tetanus, and pertussis. Okay, vaccine for children, and that DTaP vaccine for adolescents and adults. Okay, so there is vaccination program for this to prevent this disease to spread inside the population. Okay, treatment: antibiotics to kill the bacteria, medicines to stop the effect of toxin and cleaning infected wound. Okay, the medicine which you take, the antibiotic which you take in disease, the main function is to stop the secretion and the dispersal of toxin produced by bacteria, Corynebacterium diphtheria. Okay, see, this type of pseudomembranous patches will develop inside the throat. Okay, you can see here. Okay, this is a pseudomembranous. Okay, see, this is a person who having diphtheria. You will see here this is a pseudomembranous patch, which is the characteristic feature of diphtheria disease. Okay, in which you will do not feel well and you will feel so lethargic to inhale the air. Okay, you feel very bad when you inhale the air. सांस घुटती है, suffocation type condition develop हो जाती है. Okay, if not treated. Okay, so 10-year boy with severe diphtheria, in which you will see conjunctivitis, pharyngeal membrane, bulk neck, severe myocarditis, all vaccine contraindicated. Okay, next is tetanus. Okay, you know this thing. Tetanus: when you are playing somewhere and accidentally you fall on the soil, and if the soil contained a rusted nail and it will enter inside or pinched inside your body, then automatically your friends, your family members, your parents say go for tetanus injection. Okay, so this is tetanus. It is a serious uncommon infectious caused by bacterium Clostridium tetani that enters the body through wounds. Okay, symptom: tetanus cause painful muscle spasm. This bacterium affect your muscular system and nervous system. Okay, muscular spasm usually staining into the face, spreading to the rest of the body. Spasm can last from minutes to week. Okay, what is spasm? Muscle spasm. Muscle spasm means when you are doing muscle contraction, due to some reasons calcium is very less inside that contraction time, so your muscle remains at that condition, at that state of contraction, that thing called spasm. Okay, in spasm condition you cannot move your muscles. Okay, because there is not sufficient amount chemical there are not sufficient amount of calcium inside your body by which you can do muscle contraction. Okay, in 11th class you studied about muscle contraction. In muscle contraction you need calcium ions to initiate muscle contraction. So in that spasm condition, what happened, the calcium amount is very less inside the muscle, that's why spasm take place. Okay, so treatment: tetanus required immediate medication treatment in hospital. Treatment include antibiotics, muscle relaxant, sedatives, and sometimes surgery. Okay, tetanus is very deadly disease. Okay, it is a very, very deadly disease if do not treat it. Okay, if you left treated it will cause havoc to your body. Okay, prevention: the best way to prevent tetanus is to get vaccinated. The recombinant vaccine schedule is DTaP, that is you previously studied here. Okay, DTaP, diphtheria, tetanus, pertussis, that vaccine is for 3 disease simultaneously. Okay, so DTaP vaccine at 2 months, 4 months, 6 months, and 15 to 18 months, and 4 to 6 year. Okay, DTaP booster at age of 11 to 12, DTaP or DTaP booster shot for adult every 10 year. Okay, see now what will happen. See the condition. Okay, it is also called jaw lock disease. Okay, in which your jaw become locked, you cannot move the jaw, the muscle which is present inside your cheek, they get locked. Okay, see in this image that hands become locked, jaw become locked, neck become locked. Okay, in this the whole body is become locked. Okay, इसको हिंदी में धनुष बाण बीमारी भी बोलते हैं, क्योंकि इसमें जो बॉडी होती है वो बिल्कुल धनुष बाण की तरह हो जाती है. Okay, so contaminated wound, Clostridium titium bacterium, tetanus neurotoxin it secretes, and this neurotoxin act on your nervous system and muscular system. इसलिए इसको जॉ लॉक डिजीज भी बोला जाता है. इसका नाम एरो हेड डिजीज भी होता है. ओके, these all are different name of tetanus. Okay, next disease. Okay, it is also familiar to you, tuberculosis, TB. Okay, it is the disease of your pulmonary respiratory system. Okay, or your respiratory system. So it is caused by Mycobacterium tuberculosis. Okay, it is a bacterial infection that affects the lungs and can spread through air when the infected person cough, sneeze and spit. It is preventable and curable but can be fatal if left untreated. Okay, causes by bacterium Mycobacterium tuberculosis. Symptoms: cough, chest pain, coughing up blood, weakness, fatigue, weight loss, fever, night sweat. इस डिजीज में रात को पसीना आता है जब तुम सोते हो. ओके, कफ में से खून आता है. ओके, इन योर कफ यू विल हैव ब्लड. दैट मच डेडली डिजीज इट इज. ओके, ट्रीटमेंट यूजुअली ट्रीटेड विद 6 month कोर्स ऑफ एंटीबायोटिक सच एज रिफार्मेसिन एंड आइसोनियाजाइड. इस डिजीज की ट्रीटमेंट के लिए एक 6 ड्रग की रेजिमेन यूज करी जाती है. ओके, दैट यू स्टडीड इन कॉलेज, you going to be study in medical college. Okay, prevention, BCG vaccine. Okay, BCG vaccine is the vaccine which is used for prevention of tuberculosis. Risk factor: diabetes, weakened immune system, malnutrition, tobacco use, harmful alcohol use. These all are the people who are risk, who are having the more chance of getting this tuberculosis. Okay, see, that's how it infects. Okay, if an infected person having tuberculosis, he sneeze in the front of healthy, the bacterium go inside the body of healthy person and multiply. Okay, and this is the X-ray of the person who having TB. Okay, see that much the body become thinner, and that fatigue and that weight loss take place in this disease. Okay, next is leprosy or Kusht Rosh. Okay, caused by bacterium Mycobacterium leprae. Okay, so it is also known as Hansen disease. Is a chronic infection disease caused by bacterium that affects the skin, nerves, eye and respiratory tract. Okay, leprosy is more severe than tuberculosis. Both genus are same, Mycobacterium, but the species is different. There is Mycobacterium tuberculosis, here Mycobacterium leprae. Okay, so the main system is distinguishing skin sores, lumps and bumps that do not heal after several weeks of months. फोड़े बन जाते हैं, फोड़े. Okay, that large pimples, फोड़े, these things will appear on the skin. Sores. Okay, skin stiff, thick and dry, lesions that are lightened than your normal skin color, lesions that have decreased sensation to touch. When you touch that lesions, okay, जब तुम उस घाव को हाथ लगाते हो तो उसमें पेन फील नहीं होता, because the nerve which is present at that lesion areas, they are degraded, they are destroyed by the bacterium. Okay, it is eaten by bacterium. Okay, muscle weakness, numbness or lack of feeling in hands, arms, feet and leg. Okay, total feelings, that stimulation, okay, that stimuli of your hand is lost in this disease. Okay, transmission: leprosy is transmitted through droplet from nose to and mouth during close or frequent contact with untreated cases. It not spread through causal contact. Okay, treatment: leprosy is curable with multiple therapy. Okay, multiple drug therapy. Then once a person with leprosy begin appropriate treatment, they quickly become non-infectious. Treatment usually lasts between 1 to 2 years. The treatment runs of this disease. Okay, complications. Early treatment can prevent most disability. However, any damage caused by neuropathy is irreversible and may require lifetime care. Okay, it is a very dangerous disease. In your body get affected. Okay, see, this thing will happen. Okay, you have to remove this or the lesions which is affect in that leprosy. These are when these two you touch these lesions. Okay, you do not, that person who having this person does not have any sensation on these lesions. Okay, see, that's how it affects the body. Okay, it affects any extremity of your body. Hands will be cut down to spread to stop the infection. Okay, now it's time for viral diseases. Okay, caused by viruses. So first we have common cold. Okay, caused by rhinovirus. Okay, so one of the most infectious human group of virus element caused by this disease is your rhinovirus. Okay, transmit through droplet infection, and the most interesting thing, this disease is only affects your upper respiratory tract, not your lungs. Okay, it affects above the trachea of your body. Okay, infect nose and respiratory passage but not the lungs. Okay, nasal congestion and discharge, sore throat, hoarseness, cough, headache, tiredness, these are the common symptoms that you feel every time during the winter season. Okay, this is your common cold. Okay, usually lasts for 1 to 2 weeks, 3 to 7 days. Okay, these are the remedies for that to get rid of common cold, that decongestant. Okay, for adults only, antihistamines. Okay, salt water gargles, NSAID, plenty of fluid, vapor rub, Vicks. Okay, Jandu balm, Vicks, all these, lots of Rex, Jinx, lozenges, Echinacea, warm bath, all these are good to do during common cold. Okay, next is your chikungunya, caused by a virus and that transmitted by infected by a vector is a female mosquito. Okay, so it is a viral disease spread by infected mosquito that cause fever, joint pain and rashes. Okay, in chikungunya what happens, the joint get inflated and pain take place inside your joints. Okay, symptoms: fever, joint pain, headache, muscle pain, joint swellings. Okay, and rashes on the body. Okay, time of symptoms 3 to 7 days on average, but can up to 12 days. Means after the introduction of that pathogen inside the body, after the introduction of virus inside the body, it takes 3 to 7 days to show its symptoms. Okay, treatment: no medicine, but most people recover. Okay, there is no medicine for your chikungunya. Body itself fight against that and eliminate. Okay, you will take supplement at that time, you will take antiviral drugs, but that is not that much effective against that chikungunya virus. Okay, prevention: protect yourself from mosquito bite, and sometimes travelers may be recommended to get vaccinated. Risk: rarely life threatening, but 30 to 40% of people may develop chronic arthritis. Okay, arthritis develop in the patients who got out from chikungunya. Okay, so this how the symptoms of chikungunya: joint pain, headache, muscle pain, joint swelling, rashes and fever. And this is the vector of this disease, Aedes albopictus. Okay, Aedes albopictus is the vector of chikungunya. Okay, next is your dengue. Okay, it is also most common disease nowadays. Okay, so dengue, it is also a viral disease. Okay, vectored by a female Aedes aegypti mosquito. Okay, so dengue is a viral infection spread by bite of an infected mosquito. It is more common in tropical and subtropical climates. Okay, symptom including high fever, headache, body ache, nausea, rashes, severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, and fatigue. Symptoms usually start 3 to 14 days after infection. Means when that virus entered inside your body, after the entrance of that virus inside your body, after 3 to 14 days, this disease start to show its symptoms. Okay, treatment: there is no specific treatment for dengue, but treatment focuses on treating pain symptom. Most people with dengue get better in 1 to 2 weeks. Okay, तो इसमें होता क्या है डेंगू में? In dengue what happen? Platelet count goes down. Okay, You can lower your risk of dengue by avoiding mosquito bites, especially during the day. Okay, and सबसे main बात and सबसे interesting बात, the mosquito of dengue, it lives in fresh water. Second, it bites only in morning. Okay, listen again. The special thing about that mosquito Aedes aegypti, that it lives, it give larva, it produces its larva, it completes its life cycle in fresh water. ओके साफ पानी में इसके अंडे मिलते हैं तुमको, गंदे पानी में नहीं मिलेंगे. ओके, इट द वाटर शुड बी फ्रेश. ओके, क्लीन वाटर इट शुड बी, then it will lay the egg inside that. Okay, second, it bites in morning. Normally the mosquito like Anopheles and the mosquito of chikungunya, okay, and the Culex mosquito of elephantiasis, these bites in night time, but the mosquito Aedes aegypti, it bites in morning time. Okay, prevention to reduce your risk of dengue fever, you can get vaccinated. Use EPA registered insect repellent that contain 20 to 30% DEET, that is anti mosquito repellent technique. Okay, or it will stay away, make away that mosquito from your rooms. Okay, cover exposed skin outdoors, especially at night. Okay, remove standing water, keep mosquito outside of your home, use mosquito netting at night in areas where dengue is common. Okay, this is your mosquito of dengue, which is called Aedes aegypti, which is the vector of that disease. Okay, and that thing bites in morning mostly. Okay, it is also called as tiger mosquito. Okay, your Aedes aegypti is also known as tiger mosquito. Okay, so a normal platelet count for a healthy person is 1,50,000 to 4,50,000. Okay, but when this disease happens, it will go down to 10,000 per milliliter. Okay, in this disease what happens, that pathogen of this disease completes its life cycle, destroy your platelets. Okay, so that platelets count in dengue is goes down to 10,000. Okay, when I get the dengue, when I also get dengue one time. Okay, once, so उस टाइम मेरी प्लेटलेट 5,000 तक गिर गई थी. Okay, so it is also a deadly disease when it is not get cured. Okay, next viral disease is your hepatitis B. Okay, so it is a viral infection that affects the liver and can be acute or chronic. Okay, hepatitis B chronic भी हो सकती है और acute भी हो सकती है. अब acute और chronic क्या है देखो. Chronic diseases are those disease which does not kill the organism fastly. Okay, which does not kill the organism very fast. It takes times to complete its life cycle inside the host, while acute diseases are those disease which does not go that much long. It kills the organism, it attacks the organism at a small time period. Okay, that thing is acute. Okay, short term. Chronic long term, लंबी चलती है, जैसे कि तुम्हारी ट्यूबरक्लोसिस, लेप्रेसी, ये सारे क्रॉनिक डिसऑर्डर हैं. ओके, कॉमन कोल्ड, ओके, डेंगू, दिस ऑल आर एक्यूट डिसऑर्डर. एक्यूट डिसऑर्डर में डेथ रेट ज्यादा होती है क्योंकि ये जल्दी मारता है. क्रोनिक में स्लो होती है, पर डेथ की जो कंफर्मेशन होती है वो ज्यादा 100% श्योर होती है. Okay, transmission hepatitis B spread through contact with blood, semen and other body fluid from an infected person. It can be transmitted during birth, in early childhood, through unsafe injection and sexual contact. Hepatitis B does not get transferred from one person to another person by droplet infection. It is not an infectious disease. It is a non-infectious disease which get infected if you having that sex with an infected person, or you take injections of that infected person and injected inside your body. It is just like your AIDS. The transmission, route of transmission is just same as AIDS. Okay, symptoms, many people have no symptom, but other many experience fever, fatigue, loss of appetite, nausea, vomiting, belly pain, dark urine, light colored stool, joint pain and jaundice. Jaundice is the characteristic feature of this disease. Okay, symptom usually appear within 90 days of infection. Okay, next treatment, there is no cure of hepatitis B. Okay, but treatment can help reduce the risk of serious liver diseases and liver cancer. but if you take the treatment of this disease, you will get liver cured. Okay, in this disease what happened? The liver get infected, that liver get damaged, but if you take the treatment of hepatitis B, your liver is safe at some time. For some time your liver becomes saved. Okay, so prevention, the best way to prevent hepatitis B is to get the vaccine. The CDC recommended that children and adults get the vaccine and that babies receive their first dose within the 24 hours of the birth. ओके जो नए नए जन्म हुए बच्चे होते हैं, न्यू बर्थ वाले बच्चे होते हैं, वो विद इन 24 आवर्स यदि इस वैक्सीन को ले लें तो दे कैन बी वैक्सीनेटेड अगेंस्ट हेपेटाइटिस बी वायरस. Okay, so these are the symptoms: jaundice, severe case of nausea, bloated stomach, swollen stomach, liver complications, risk factor, unprotected sex with infected person, share unsterilized items with the infected person, travel to area with high risk of HBP infection. Okay, treatment available: antiviral medication, interferon injection, and liver transplant. You can see here this stomach, belly like stomach. Okay, in which that stomach look like belly, bell, matke ki jaisi port like stomach will happen. Okay, next is your protozoal diseases. Okay, spread by protozoans. Okay, so first we have amoebiasis caused by Entamoeba histolytica. Okay, so symptoms is abdominal pain, diarrhea, bloody diarrhea, nausea, weight loss, fatigue, excessive gas, rectal pain, fever, and vomiting. Transmission by ingesting contaminated food and water. Risk factor: travel to tropical area with poor sanitation, living in institution with poor sanitation, and anal sex. Okay, diagnosis: stool examination using microscope, increased WBC count and specific antibodies in the blood. देखो जब भी कोई infection होता है body में, every time when an infection take place inside your body, WBC का count हमेशा increase हुआ मिलेगा. Okay, these are your antibodies, these are your warriors, body warriors. Okay, white blood cell number always increase during the time of infection. Okay, treatment: normal treatment available for this disease, that is your metronidazole, tinidazole, nitazole, dihydroxythiamine, and chloroquine. These all are the drugs which is used as an anti-amoeboid anti-amoeboid drugs. Okay, next, prevention: improve sanitation, washing hand frequently with soap and water, avoid raw fruit and vegetable, drink sealed bottled water or boiling water before drinking. Okay, how can you prevent this disease? Simple: eat cooked food. Okay, eat cooked food. Okay, avoid that directly eating food, vegetables and fruit. First wash them, then eat them. If you are drinking water, make sure that water is pure, or if you have any doubt on that water, then boil it and then drink it. Okay, see, this thing will happen inside that this disease amoebiasis. It is also called amoebic dysentery. It is an intestinal illness caused by parasite Entamoeba histolytica. This parasite live inside the intestine and produces eggs which is called cysts, and which are passed from body in the stool. Okay, you can see here these are the cysts produced by Entamoeba histolytica. Okay, next nematodes से होने वाली disease, that is your Ascaris. Okay, which is caused by Scaramanthus. Okay, so that thing, Ascaris, is the most common worm parasite found in human. It lives in the people's small intestine. The parasite is spread through contaminated soil. Okay, Ascaris infect is treatable with medication. Ascaris infection is sometimes called Ascaris. Okay, Ascariasis, intestinal parasite. It is common round ball, internal bleeding, muscular pain, fever, anemia, blockage of intestine passage. Eggs of parasite excreted along with the fecal of infected person, which contaminated soil and water and plants. Okay, see this, these are all the symptoms. Okay, internal bleeding because it infects your small intestine, that causes internal bleeding. Muscular pain. Okay, then fever. Anemia, it will suck your blood, that That's why anemia condition occur. Blockage of intestine passage. If this is your intestine and it is filled with ascaris, then automatically your intestine become blocked. Okay, see, this is a internal view in which you will see ascaris is present inside the intestine. If it is blocked with that these parasite, automatically your blockage of intestine take place. Okay. Next is your elephantiasis or your filariasis, okay, which caused by Wucheria bancrofti. Okay, so it is also known as lymphatic filariasis disease that cause severe swelling and disfigurement of the body, caused by parasite roundworm transmitted by mosquito bite, and the mosquito which causes this is called Culex mosquito. Okay. Culex mosquito, and the parasite is your Wucheria bancrofti. Okay, the parasite roundworm that causes this elephantiasis is Wucheria bancrofti, and that mosquito bite that causes this is your Culex mosquito. Okay, symptoms: swelling of limbs, external genitalia and scrotum. Okay, then complication: pain, mobility issue, bacterial infection and permanent disability. Treatment: anti-parasitic drugs, surgery and management strategies like elevation and compression garments. Okay, and prevention: avoid mosquito bite and eliminating breeding places. Okay, see what thing happen in this. Okay, that's how this disease affects. It affects your lower lymphatic system. Okay, the lymphatic system which is present in your lower side, in your abdominal side, is the place where this parasite live and work there. Due to that breathing of this parasite in this lower abdominal area, okay, it will cause inflammation of that area and it will look like elephant foot. That's why it is called elephant foot disease or elephantiasis. Okay, so this is their Scalemanthus, that parasitic disease, okay, caused by a parasite nematode, that Scalemanthus Wucheria bancrofti. Okay, see, after surgery what happened? This is the leg which is having the infection of that thing, and after surgery this thing will happen. Okay, we have to cut all that mass. Okay. Now next is your fungal disease caused by ringworm, Candida. Okay, it is contagious, easily spread and can appear almost anywhere of the body. It is more common in arm and leg, but can also affect the feet, growing in scalp. Ringworms on the feet is often called athlete foot. Okay, when ringworm occurring on the foot of human, then it is called athlete foot. Okay, then and ringworms on the groin is called jock itch. Okay, groin, this area. Okay, ringworm thrives in warm and moist environment. Okay, automatically you know where is the fungus grow. It grows in warm and humid climate. Okay, so warm and moist environment such as pubic showers, locker rooms, public showers and locker rooms and pool areas can spread easily when people are in close physical contact or through objects like combs, brushes, hats, towels and clothing. Okay, अगर तुम अपने मतलब तुम हॉस्टल में रहते हो, ओके, और तुम अपने बाजू वाले का तौलिया, कंगा, ओके, कपड़े यूज करते हो, तो ऑटोमेटिकली यदि उसको रिंगवर्म है तो तुमको भी होगा, क्योंकि ये है इन्फेक्शियस डिजीज. ओके, इट इज एन इन्फेक्शियस डिजीज विच इजली spread from one person to another person by using their infected items. Okay, to treat ringworm you can apply antifungal cream or mild cases. Take antifungal medicine such as tablet, cream, gels or spray for more severe cases. Okay, use prescription medicine if the ringworm has spread to the fingernails. Okay, save the infected hairs if the ringworm is in beard area. If you have that ringworm in beard area, then trim that hair. Okay, next, to prevent ringworm you can keep your skin clean and dry. Okay, wear flip flops in locker rooms and public showers. Change your socks and underwear at least once each a day. Do not share clothes, combs, brush and towels. ना कभी भी अपने पर्सनल सामान, पर्सनल यूजेबल चीजों को शेयर मत करना. Okay, do not share your clothes, combs, brushes and towels. Okay, wash your hands with soap and water after playing with pet. Okay, now see what happened. This is the ringworm. Okay, infection. This is scalp ringworm which happens in your scalp. Okay, this is hand. Okay, it also happens in foot and groin area. Also here you see it happens in groin area. Okay, so this is all your diseases. Now thank you for watching. Keep learning, keep building your future with tapasya. Okay, and kabhi झुकने का नहीं. And in next lecture we are going to discuss about malaria, HIV and cancer. Okay, thank you for watching. Okay.